Yeah, we can move into getting things started.
Let's do it. So I have the pleasure of introducing Brit Cervantes. Brit is the program coordinator and community education specialist for UCI's Pediatric Gender Diversity Program. Their role within the program is to assist patients and families with navigating their social, legal, and medical transition. Brit is also on the board of the directors for the LGBTQ Center Orange County and is the co-chair of the Transitions Health and Wellness Committee. Welcome, Brit.
Thank you so much. And so again, my name is Britt, and my pronouns are they, them. He, him's also okay for folks that are still learning on how to use gender-neutral pronouns. We'll be talking a little bit about that later. And again, I'm the program coordinator and community education specialist for UCI's Pediatric Gender Diversity Program. I'll be going over a little bit more about the services that we provide to folks and the resources that are available to the community that we serve. And so with that, I'm going to start sharing my screen so that you folks can take a look at my slides and we can get things started. Let's see. Got it. Oh, okay. So I guess my computer is choosing to go low. But for today, we have some objectives that we're going to be going over. So we're just going to be going a little bit over the foundational understanding of nomenclature, things like pronouns, acronyms. But I don't want to go too
So
leaving
we
you
have a
folks.
bit of a, oh, you froze for just a second there, Britt, if you wanted
Oh,
to maybe start over on this objective slide.
okay, yeah. So I'd really like to focus more on advocating for patients today. So the foundational understanding of things, I will go over it briefly. If anybody has any questions, please feel free to ask, and I will go over those for you. But I would like to focus a lot more on how we can advocate for LGBTQ patients within our healthcare settings. I also do like to start off by saying that I myself am trans. So I was assigned female at birth, and I have faced a lot of the things that our patients go through personally. So when we are trying to advocate for our patients, oftentimes there's a personal purpose for that, and really I want this to be a space where you can feel comfortable with asking questions. We cannot expect every trans person to educate us, but I am a trans person that is interested in educating you. So please know that this is a space where you can ask questions, and hopefully it'll help you become a more affirming provider for your patients in the future. So our program, we are Orange County's only interdisciplinary program that is completely dedicated to providing care to transgender and gender expansive children, teens, and adults. Previously, our program, we were only able to see folks up to the age of 26, but we are now able to see patients of all ages. Some of the services that we provide include patient and family counseling, puberty suppression, gender affirming hormone therapy, sexual health education, and HIV prevention, community connections and support. And the parts that of our program that I feel very strongly about, and is at the heart of what I do for our patients, is provider and training education and school and community engagement. So we work really hard to advocate for our patients both within and outside of our clinical space. When discussing the importance of LGBTQ education, we always want to talk about a 2011 study that found that the average amount of time spent on LGBTQ specific medical content within medical education is around 5 hours. And this is if medical students are receiving any sort of information at all. And this is highly variable depending on where folks are going to school. And this is something that makes it so that providers are leaving their medical education and going out and providing care to patients, and they don't feel comfortable or confident in their abilities to provide care to LGBTQ folks. Just very briefly, some terminology so that folks have at least a foundational understanding of what we're going to be talking about today. Gender identity is going to refer to a person's internal sense of self, of being either male, female, of something else, or something in between. Every person has a gender identity. It's just that folks whose gender identity is outside of the binary or it differs from their sex assigned at birth, these folks have to think about it quite a bit more. Sex assigned at birth is a way to refer to what somebody's biological sex could be, which is oftentimes based off of external anatomy and sometimes chromosomes. We will say sex assigned at birth because it is more inclusive to folks who may be intersex or who may be trans-identified. And also is a better way of wording it, instead of referring to somebody as a real woman or a real man or a biological female, we would say this person was assigned female at birth, which is oftentimes referred to as AFAB, or assigned male at birth, which is AMAB. When we're talking about gender identity, we also want to talk about gender expression. And this is the way that people will express their internal sense of self. So this could look like choices that are made in terms of hairstyles, the way that folks want to dress, mannerisms that they might have when talking, and these are oftentimes associated with being feminine or masculine, and that is oftentimes based off of a societal expectation of what it means to be male, female, or masculine or feminine. Lastly, we have attraction. So we're talking about physical attraction or emotional attraction to other people. And what often happens is sexual orientation and gender identity are conflated. They're treated as if they're the same thing, or that if you know one, you know the other. But sexual orientation differs from gender identity because sexual orientation is who we're attracted to, and gender identity is who we are. So you can know how somebody identifies in terms of their gender identity, as they would identify as male potentially. You can't make assumptions about who they would be attracted to because it would be just that, an assumption. And really the only way that you can know a person's sexual orientation or their gender identity is if they tell you, and there are appropriate ways to ask and appropriate times to ask. We really want to build up a relationship with our patients where they feel comfortable enough to share this information with us. And moving into talking about affirmed name and pronouns, these are really great ways to affirm a patient's identity or even a person's identity. Just in general, these are things that can be done inside and outside of our clinical spaces. Previously referred to as preferred name as pronouns. The reason why we put that, we put preferred, is because a lot of folks are moving away from referring to it as that because it implies that their name and their pronouns are preferences and not their actual identities. So some other terminology for affirmed names could be confirmed name, asserted name, but our clinic, we typically will go with affirmed name. Some folks will still refer to it as their preferred name, and that is going to be individual preference. And pronouns are pronouns that are used to refer to someone in place of their name. Common pronouns are they, them, he, him, and she, her. These are not all of the pronouns that a person can have for themselves. These are just common ones. Anything that's not listed here is not any less valid. These are just the ones that we will see most often. Affirmed name is going to be a name that's used in place of a person's legal name. And please do not refer to a person's legal name as their real name. Their real name is the name that they have provided to you. And so we would ask folks what their affirmed name is. And then when they provide that information to us, we want to be sure that we are using it. If patients are giving us their information, We want to show them and demonstrate that we're listening and use the correct name and pronouns when talking to them and about them. We're going to talk a little bit about the gender binary and the things that are implied by it. So the gender binary is the concept or belief that there are only two genders, male and female. And this concept implies that there are only two genders, and that all of the parts of a person's identity will line up with that. So what that means is that their gender identity, that their expression, and their sexuality will all line up perfectly with one another. So this could look like somebody being assigned female. That would mean that their gender identity is female, their expression is feminine, and that they will be heterosexual or attracted to men. The gender binary implies that all of these things will be true about each person based off of their sex assigned at birth. So what is wrong with the gender binary is that it perpetuates heteronormativity and cissexism. So heteronormativity is the assumption that people are straight, and this happens very, very often. It can come up in our clinical spaces when we're asking people about their social history or their sexual health history. We're asking if they are a person that's assigned male, if they have a girlfriend or a wife, and we are not asking questions in a way that is allowing patients to tell us this information about themselves. There are assumptions being made based off of the gender binary. Whereas cissexism assigned at birth. So assigned female identifies as female. That would be a cisgender female. Cissexism implies that cisgender people's bodies and identities are more natural and legitimate than transgender and intersex people. It is the assumption that cisgender people are the natural way, they are in alignment with the way that things should be, and anything outside of that is wrong or needs to be corrected. So ways that cissexism comes self-care can look like bathroom access, only having male or female restrooms available, no gender neutral restrooms available to anybody who might not identify as male or female. That can look like language not being inclusive in terms of gender identities and expression on intake paperwork. Very, very commonly do I see for women only, and it's asking questions about histories of pregnancy or menstrual cycles. That could also look like not having room for somebody to list what their affirmed name or pronouns might be. Insurance barriers, and we'll be talking a little bit more about that there are currently no federal protections for LGBTQ folks, and especially for trans folks, which means that it is up to each state to determine whether or not they will have legislation in place to protect transgender folks. And very recently, I'm sure you have, if you have not heard about the legislation that has come up in Arkansas, where it is a felony for providers to provide trans care to folks under the age of 18. So insurance barriers oftentimes come up within healthcare, and it is a demonstration of cissexism, because this can also look like hormone replacement therapy being accessible to cisgender people who might have low testosterone or low estradiol, and trans folks trying to get prescribed that same exact medication have far more many hoops that they have to jump through in order to get access to the exact same medication. Housing and rooming in healthcare settings. If anybody has an inpatient procedure or has to, be watched for a little bit longer after something that they had done, they could be housed in a place where they were not asked. So oftentimes what we hear from patients, if they're in sort of any inpatient, is that because they were assigned male at birth, despite being female identified and female presenting, they were housed with men. And so these are different ways that cissexism is coming up in healthcare, and ways that things that we should be looking at and addressing as healthcare providers. When we're talking about the transgender community and advocating for the transgender community, we must also advocate for the intersex community as well. While it's not the same being intersex as it is being transgender, we have to include folks with intersex bodies in our conversations, because oftentimes they are facing similar discrimination and stigma within healthcare and societal settings. Many intersex children are often having to undergo unnecessary and irreversible surgeries without their consent, as advised by their providers. If they have external genitalia that is not typical with what we would associate with the traditional idea of being male or female in terms of our the way that our genitals look. And for other intersex folks, they're being rendered invisible within medicine and in our society by not being included, not having anything in any questions in research surveys about intersex traits that they might have. And also, very similarly to transgender people, intersex folks are frequently disrespected and face discrimination in healthcare and social settings. And this often comes in the form of invasive questions, and many times for intersex folks, invasive physical examinations, because providers are curious about what their bodies look like. And so these are things that we should also be discussing in our conversations of advocating for LGBTQ plus folks. Reproductive justice. So the long-term ramifications of hormone replacement therapy and their impact on fertility are largely unknown. And it is for this reason that for folks where there is a potential that it is important for them to have biologically related children, that they should pursue fertility preservation prior to any sort of treatment. This is encouraged. It is something that we educate our patients about, because it's also another item that's not, providers are not educating their patients about, but it makes it difficult when there is very limited coverage when it comes to fertility preservation. So patients might want it, this might be important to them, but it is largely inaccessible due to cost. Providers, again, might not be providing proper counseling regarding fertility options. There's a huge lack of gender-affirming reproductive endocrinologists or other providers who would be able to assist with fertility options. Intersex patients that may have had any sort of medical interventions as infants could potentially be rendered infertile. And again, they were not participants in that conversation. These were things that were done to their bodies before they could even speak. Again, limited insurance coverage. Currently in California, Medi-Cal does not cover fertility preservation. So that would have to be something that patients would be paying for out of pocket. But if they're on Medi-Cal, it is difficult to say that they would be able to have the money for fertility preservation. And then again, lack of gender affirming reproductive endocrinologists. So patients are oftentimes having to choose between making a decision for their mental health and their physical well-being for now to get onto hormone replacement therapy, with the knowledge that in the future they may not be able to have biologically related children, even though this might be important to them. And this is something that we should be working to also advocate for our patients, and be mindful that this is an issue, and these are things that our trans patients are facing when trying to affirm their identity and also having a family with biologically related children in the future. Gender affirming care is any sort of medical intervention that a trans person might pursue in order to affirm their identity. This oftentimes includes hormone replacement therapy, puberty suppression, and or surgery. And it is always very important for us to note that there are no minimum requirements for any transgender person to pursue in order to be trans. So this, what we mean by this is that trans people do not have to have any sort of medical intervention at all in order to be trans. There are some trans folks that they have no interest in any sort of hormone replacement therapy or surgeries. There are some trans folks who have interest but will never have access because it is financially something unavailable to them, or socially is something unavailable to them. And these folks are no less trans than other folks who pursue everything possible that they can, from surgeries to hormone replacement therapy. There's no set standard. There's no one way to be anything, and it is no different with being trans. We are here to affirm patients and to let them know that we see them, and be resources to them as they are navigating this oftentimes overwhelming process of transitioning. And folks can participate in providing gender affirming care, even if they are not directly responsible for being or being part of the team that is managing their gender care. You can be an affirming provider just by treating patients with dignity and respect, using the correct name and pronouns. And this 10 most important things to know are directly from transgender people that they hope their providers know, so that they can feel confident and comfortable with their care that they are receiving. So understanding the difference between sex, gender, and sexuality. Hopefully after today, you folks have a better understanding of that, knowing that clinicians should be part of a team. And again, you don't have to be part of the folks that are prescribing hormone replacement therapy. You could just be a primary care physician that they see regularly and they're accessing care with, and you are helping them have better health outcomes. Appropriate, it is bolded for conducting appropriate, complete histories and physical exams. We want to make sure that we are being mindful about the language that we're using with our patients and the process that it takes for patients to come in to see us. If we have to do a physical exam or ask questions, we want to let patients know why we're asking these questions. You can start off by saying, we ask all of our patients these. They might feel a little bit uncomfortable, but I'm going to ask you some questions about your sexual health, or talking about physical exams, letting them know why it's important, taking your time with your physical exams, and creating a culture of consent, asking before doing things. Knowing some of the hormonal treatments for trans men and trans women, knowing some of the lab tests that are needed to monitor and minimize any sort of negative long-term effects of using hormone replacement therapy, knowing some surgical options. And lastly, what's very, very important, and is one of the easier things that you can do, is just knowing local resources. If there's something that you cannot provide, if at the very least you know where you can direct patients to, is going to be an extremely helpful tool for your patients. Personally, when navigating these things, it was very difficult because my providers did not know where resources were. When I had questions, they didn't have answers, and they didn't know who to ask for answers. So just knowing this information is going to be extremely valuable for your patients who are going to be coming in, hoping that you know the answers. When we're talking about transgender health, we also want to talk about the social determinants of health for transgender folks. This is a graphic that I really like. It says mental health, but we can also apply it to healthcare. If we want to address healthcare and mental health, we need to dig deeper. We need to do this with an intersectional perspective and with utilizing some social justice within our mindset as we're doing that. When we're looking and digging deeper into things that are preventing folks from having access to care, we're starting to see some other things like injustice, trauma, racism. These are all things that impact a patient's ability to access care and their ability to continue care. So race, gender expression, gender identity, and socioeconomic status are some things, only some things, that can impact a transgender person's access to care. So we want to keep this in mind. What is it that is happening outside of our clinical space, as well with within our clinical spaces that is preventing our patients from getting access to care? Are they experiencing discrimination within the clinical settings that we are also practicing in? Are they getting misgendered by ourselves or by the folks that we work with? There are things that we can do to address and advocate for patients so that they're continually getting access to care, and we're doing what we can to help them get there. I'll skip this one. And so it's just kind of moving more into some of the health disparities, a little bit more explanation. So there's quite a big bit of stigma and discrimination associated with being trans, or even just being perceived as a trans person. And this can lead to adverse mental and physical health outcomes. The transgender community makes up a relatively small but still significant and still meaningful portion of the population, but there are high rates of violence and attacks committed against trans folks. It is absolutely a issue when it comes to Black transgender women who are having violence committed against them at extremely alarming rates. And these are things that are oftentimes preventing folks from getting access to care because they are also concerned that they will experience this type of violence even within healthcare settings. And unfortunately, it also is happening within healthcare settings. When we're talking about mental health and the transgender community, we always want to remind folks that being transgender is not a mental illness. It is not a mental health concern. The diagnosis for gender dysphoria is currently housed in the DSM-5, which makes it a little bit tricky, and there is some stigma associated with having the diagnosis housed in the DSM-5, but it is not that, again, being trans is not a mental illness. It is something that we should be working to minimize any sort of stigma, and in the future, the diagnosis for gender dysphoria will be moved into the ICD, but it'll take some time before we actually see that happen here in the United States. But there is a high rate of suicide amongst trans folks, and this is often associated with lack of acceptance and discrimination and stigma that folks are experiencing. And so we also want to be trying to help our patients get access to mental health providers that are gender affirming, as well as getting access to healthcare providers. So mental health and healthcare, they can go hand in hand for our trans patients, so that we can help improve their mental and physical health outcomes. Trans broken arm syndrome, for folks, if this is your first time hearing about this, this is when a transgender person goes in to get care for really anything, in this case, broken arm, and the medical provider is focusing their time and attention on that transgender person's either use of hormone replacement therapy and or their trans status. So they're clearly there with a broken arm, but the provider is asking them why they're on hormone replacement therapy, or making comments about their gender identity, or really not focusing on the fact that they have a broken arm. They're focusing on other things that are at that time irrelevant to their care. Very recently, we had a patient that we had referred because of a high white blood cell count to a different provider, and we were concerned that it was something that should be addressed, and that provider was refusing to think that it could have been anything else but being caused by their use of hormone replacement therapy. And we had to advocate for this patient for further testing, and it was found that this patient had leukemia, which is completely unrelated to their use of hormone replacement therapy. And had we not been there to advocate for our patient who knows how that could have gone for that specific case. And so we really want to focus on the whole picture. Yes, if there are symptoms that could potentially be associated with hormone replacement therapy, we don't want to make that our entire focus. We want to look at the whole picture and look at the patient and listen to the things that they're telling us, instead of just focusing on their gender identity or their hormone replacement therapy. Microaggressions are everyday verbal, nonverbal snubs or insults, whether intentional or unintentional, that communicate hostile, derogatory, or negative messages to people that are part of a marginalized group membership. There are lots of folks that experience microaggressions, and unfortunately, and that's an unfortunate truth, and the transgender community is really no different. When these are some folks that are trans and non-binary and genderqueer that are just kind of showing some of the things that they have personally heard that are microaggressions. So asking folks if they had the surgery, asking folks if they transitioned because they thought that they were ugly, or making comments of like, I never would have known that you used to be a girl, asking folks when they're really going to transition because they're not accessing any sort of medical interventions. And then, of course, you are so beautiful for a trans girl. These are, while again, intentions can be good, and they can, you can be saying something with, while meaning well, or meaning to have it come off as a compliment, we always have to be mindful of our intentions versus their impact. So when we're saying things to folks, if they share with us that it didn't feel good and that the impact didn't match our intentions, it's not our place to tell them that what we said was meant to be a compliment, or downplay any sort of hard feelings that might have come up for them. We need to be mindful of what we're saying and work on finding other ways. We can compliment patients if we're very excited for them and we see how much they have changed. I know that we are very excited for our patients when we see them every few months and we see that their hair is longer, or we hear that their voice is deeper, and these are changes that we know that these patients wanted. We can compliment by saying things like, I love how much happier you're looking, or how are you feeling about these changes, and asking patients how they're feeling about them. It's a conversation that we can have, and it'll help us build a solid relationship with this patient so that we can learn about the language that feels good for them, so that when we want to share their successes with them, that we can use language that we know will have the intended impact that we're looking for. So wanting to move into advocating. So we've heard a lot of the stigma and the discrimination and things that our patients are experiencing, but how do we work together to make it so that patients feel more comfortable and confident within our healthcare settings? So we can work together and with our clinical staff to create a gender-affirming environment. I always want to share with folks that the visit starts before the patient gets in your office. It starts with the very first phone call. So if you are having patients that are getting misgendered on the phone with your front staff, they will likely never make it to you. So you can be a provider that puts in all of the work and is educating yourself and is knowledgeable. But if your staff is misgendering your patients or using the incorrect names for them, they won't know that you are an affirming provider. What they see is that you could potentially be an affirming provider in a space that is not gender affirming. So we have to take a look at where we're actually seeing patients. We have to ensure that our staff is educated and that patients are having an experience that's consistent within our healthcare settings. When we are seeing patients we want to treat for immediate and health, if you're a primary care physician, or if you're not a provider that's directly involved with their hormone replacement therapy, you can still be very much part of the process for them in receiving gender affirming care by putting in the work and making sure that they're following up with you, that they're seeing you routinely, and that they're taking care of their bodies. annual physicals, patients should be encouraged to take care of the body parts that they have in a safe environment. So for example, for our trans feminine patients, we want to ensure that we're suggesting that they're getting routine prostate exams. We wouldn't be recommending, any sort of gynecological care that's different for that particular patient, because we're being mindful about the actual body parts that they have and not just making blanket assumptions off of what we think that they should have based off of how they look. For our trans male patients, they are very routinely avoiding pap smears because they cannot find a provider that is affirming, and it is deeply uncomfortable going to these places that are historically for women and looking like a masculine person in these spaces by themselves. That is deeply uncomfortable. And so it can be a part for us to advocate for these patients by just knowing who we can refer to for these items, or even being the provider yourself that is working to ensure that your patient feels comfortable with getting these type of routine exams in your settings. Cancer screenings, again, we want to make sure that we're screening for things. Conversations about sexual health can feel uncomfortable, especially if you're not sure how to do this in a gender inclusive way, but take the time to learn how to be gender inclusive and ask open-ended questions that will help you provide any sort of resources that are relevant to your patient. We cannot assume that just because somebody is part of the LGBTQ community that they need any sort of HIV testing or PrEP or anything along those lines. We have to ask, and assumptions should not be made about this. It should be, they should be recommendations if they are clinically indicated for that specific patient. Knowing some hormone replacement therapy options. If you don't feel comfortable prescribing, know some local providers that are comfortable prescribing. So if you have a patient that comes into your space and is looking for these resources, you know who to refer them to. You want to be aware of surgical interventions. You don't have to be the provider that is providing these services, but if you just know where you can refer to for any sort of surgical interventions that your patients might be needing, and understand the process for referrals for these things. That is a very, very important thing that providers can do, is knowing what it takes to refer patients over for surgery. Insurance companies are not consistent in their requirements for this. And at the end of this, towards the end, I'll be talking about a resource where you can learn more about what it takes to refer a patient. And that would be important and a helpful thing that you can do for your patients to make their transition a little bit easier. Again, discussing fertility options, knowing where you can refer folks to, mental health screenings. Again, don't assume that just because they're part of the LGBTQ community that they have mental health concerns, but you can generally at least have some resources available. Know some of the common health insurance for your insurance issues for your patients and how to resolve them, and see how you can advocate for folks. And then lastly, as providers, you do have a role with the name and gender marker change process. If you are here in the state of California, it made it a little bit easier. Before the folks were required to have a physician's affidavit from a provider indicating that yes, they're trans, and that yes, they should have their gender marker changed, and knowing the language that it should be included on those letters, and being able to be comfortable in writing those letters for patients. For any sort of federal documents like passports, these letters are still required. And so knowing what that would take and how you can write those will also be another way that you can advocate for their patients and make their transition a little bit easier. So the resources, if you're looking for some really excellent information that's available to you, we are constantly using the UCSF Center of Excellence for Transgender Health. They have quite a bit of information that is very extensive and it's easy to read, whereas the Endocrine Society has very similar guidelines, a little bit more dry of a read. So we don't look at it as much unless we really have to, again, because we take a look at the UCSF guidelines. If you're wanting to find the standards of care for transgender health, you're going to take a look at WPATH, or the World Professional Association of Transgender Health. They have standards of care that they release to medical providers so that they can understand a little bit more about what it should involve when it comes to providing gender affirming care. And when it comes to physical exams, again, creating cultures of consent, Fenway has a trauma-informed care that's there that would be is an important resource that we also use. For social and support and patient resources, our program has a digital resource document. You are more than welcome to take a look at it. If you are within UCI and you're using our EPIC system, we do have a smart phrase that we share with you folks that we use, that any sort of patient that we have, we just entered that into their after visit summary so that they can access it at future visits. Our local LGBTQ center OC is in Santa Ana. Again, if you, wherever you folks are practicing, learn where your local LGBTQ center is so that you can provide that information to patients. PFLAG is a family support group. And Transgender Law Center, if you're interested in learning more about your role as providers in the name and gender marker change process, that is also helpful, and that's something that can be provided to patients. Changing your name is confusing, and so this is an excellent guide that you can send over to folks. So with that, so our key take-home points: sex, gender, and sexuality, all three are separate concepts. They relate to biology, expression, and attraction, and all of these concepts are far from binary. We want to move away from the gender binary and the harmful things that are perpetuated with it. Ally is a verb. We want to demonstrate this. It's going to be ongoing. And sometimes, and when I say sometimes, a lot of times, it's uncomfortable. But we want to be doing this because this is how we can be better for our patients. And lastly, mistakes are going to happen. Learning is going to take time. You can guarantee that you are going to misgender a patient at least once. And the point is that you want to correct yourself, apologize, not over apologize, but apologize, correct yourself, educate yourself, and move forward and make a consistent effort to be learning more so that your patients are not having to educate you because you are educating yourselves, and you are also taking the time to advocate for them in that way as well. And so we have our contact information here. Mine is at the very top. I am happy to be a resource for folks and answer questions. And I know personally how difficult this can be. And so I do try to make sure that I can answer questions for folks so that it's a little bit easier and a little less overwhelming. Our medical director, Dr. Ajanta Naidu, our associate medical director, Jeffrey Wu, and our previous medical director, Dr. Lynn Hunt. She has retired, but she's still very much involved in our program in the background, and we would not be a program if it was not for her advocacy. And so with that, I'm going to stop my screen share and kind of move into some questions for you folks. So if anything that you have, if you wanted to ask out loud or send it in the chat.
Well, first, thank you, Brit. You bring a really necessary perspective to this conversation. Instead of it being, talking at us, it's inviting us to partner with you. And I think that's really powerful. I also just want to make the point that much of what you introduced today is not necessarily unique to the trans experience. Partnering with your patient and to be a good provider, asking questions before doing things, being respectful of the journey that they traveled before they came into your office are things that we should all be thinking about regardless of the patient's gender identity. So I really appreciate this talk because it was so pointed and so transferable. Not to minimize or trivialize the trans experience, but I think that we all have something to learn about any patient encounter we have, regardless of their gender identity. So thank you. If people have questions, by all means, drop them in a chat box or just unmute yourself. It's a conversation. And as always, feedback, we want it. There's a feedback link. The same link that you use to sign in is the same link that we use to collect feedback for all of our sessions. No matter if you're a formally registered student in the elective or otherwise, we still want to get your feedback on these sessions. That's how we make them even more powerful. Like for example, even this stuff. Yeah, go ahead, Caitlin.
So how, I guess, as a provider, how can one like help a patient who identifies as transgender, but their parents, it's like a hard topic to talk about with them, and they're so they're minors, so the parent, I guess, has to be in the room. So how, as a provider, can you keep that patient safe and like still make them feel comfortable, even though that conversation with their parents is very difficult to have?
Yeah, that's actually something that that's a good question, and it's something that comes up pretty regularly. With our clinic, it is helpful because they, while parents might not be completely supportive, they're at least in our clinic. So that tells us at least something, very minimal something, but they're there. And what we typically will do, if when we have a young person, especially if parents are using their incorrect name and pronouns, we are very intentional about making sure that we are using the correct name and pronouns in front of the parents consistently, just so that we can, demonstrate to the patient, even if their parents are not using the correct name and pronouns, that we are, that we see them for who they are and that we are affirming their identity. Most times we find that parents start to kind of catch themselves and start to correct themselves, at least in the clinical space, that they're trying to use the correct name and pronouns because we are doing that. We also make it a point to have resources that we could get patients connected to and to their family connected to. Folks are they're persuaded by different things. Some folks want to know all the research that is available when it comes to transgender health. So having some resources for that and saying, this is research that shows if a young person has family members that are supportive, that they have better health outcomes, that they are doing better emotionally, they're doing better physically. And so these are what we're going for. Oftentimes, I think parents are coming from a space of wanting to do what's best for their child, and there are a lot of unknowns when it comes to trans care. So we, as providers, can help them understand that them loving and supporting their child is the best thing that they can do. And to do that, they have to, at the very least, use the correct name, the correct pronouns. Other patients and their families, for example, might feel other parents. So knowing some social and support groups for the parents that are local would be a potential other option to provide as resources. So just letting them know, like, about groups like PFLAG, where they can meet with other families who are going through similar things and they can talk about these things. And so that other families can say, we had a hard time with this as well, but these are the things that we saw that changed in our child, or these are the things that we, this is how we have grown as a family together because we have chosen to go through this together. It really will kind of depend, and advocating could look like getting them directed to and asking them, well, what would make you feel most comfortable with your child transitioning? Do you want the research? Do you want resources? And then just getting them connected to what would help them. And lastly, I think sometimes parents also just want to feel like they're being heard, that their concerns are being heard, and that they're not being left out of the conversation, and that you're just, regardless of how they feel about it, you're just going to move forward with it anyways. It's just, we hear you, we know you want to do what's best for your child. This is what we know. These are the resources available, and then finding a way forward together. We always share with our patients that it's not just the young person that's transitioning, the family's transitioning. And so kind of making sure that everybody feels comfortable as much as possible, while maintaining a focus and keeping that young person as a priority, because that is your patient. That is the one that you're advocating for, and you're trying to help them get to where they're going, and trying to help their parents understand that process too.
Thank you.
Any other questions from folks? And it could really be about anything. I'm happy to answer questions that folks might have.
I actually do have a question. So in wanting to be, a verb-oriented ally, I've been really frustrated by the recent presentation of anti-trans legislation.
Mm.
I don't know what to do with that frustration. I think in the kind of social justice movement around race, I often just advise people like, look it up. I'm not going to tell you. But if you
Mhm.
are the open book that you claim to be in this space,
Mhm.
Brit, I wonder what you would call upon from your cis allies in the face of all this legislation, especially because we're not necessarily in a state that's perpetuating a lot of these ills.
Mhm.
I can't go vote in Arkansas, right?
Mhm.
I don't
Mhm.
necessarily have sway as an Arkansas governor's constituent. And so I wonder how you've either instructed some of your, fellow like compadres in the LGBTQ community or others in terms of cis allies to support in the face of
Yeah.
all this really nasty
Yeah. Yeah.
state of action.
Yeah. As a person that works in trans care and as a trans person that hits in two different ways, seeing all of the legislation that's coming up. And what's important is that national conversations that are coming up around really any marginalized group, but in this particular case about trans folks, oftentimes it is difficult to hear people having very casual conversations about whether or not trans people should have the access to use the restroom in public. With all of the bathroom bills, that was a conversation that I was hearing people have, whether trans people have a right to have access to healthcare, which is what a conversation is having right now. And so as cisgender allies, as providers, different ways that we usually recommend, or that I can personally recommend, is knowing of any sort of advocacy groups that are local to the place where legislation is being proposed. So even if in California we're kind of limited on some of the things that we can do, there are grassroots organizations that are located in the places where legislation is coming up, learning about those resources. And oftentimes, if you have the financial means, donating to these organizations that are fighting legislation like that. That's something that can come up, and that comes up pretty regularly with other issues that as well, when we are hearing things about reproductive rights for women being taken, or for people being taken away. Focusing on supporting groups that are able to do something, that are providing actionable things and supporting them monetarily. If you can't do it yourself, at least help provide funding for them to continue their work. There are also other organizations that are national that are also working to do things. Of course, that providing funding to them is a little different because it's not going directly to people, and it's some with the way that nonprofits work. Sometimes that makes it a little bit harder to go directly to people. But at least providing some support there and signing onto any sort of letters. WPATH is constantly making statements, and I'm regularly using statements of medical necessity or statements from WPATH to help get coverage for things for our patients here. So those are other ways that we can kind of advocate for folks. And I think just lastly is, even though legislation is being proposed in other states, that the impacts are still felt here, because our students and our youth and our young people are still hearing these conversations too. And so even if we're making statements here in the state of California about things that are going on in other places, younger people are hearing it here. That yes, there are people having conversations about whether or not you should have a right to use the restroom in public, or whether or not you should have access to care. But know that here, there are people that are here for you, and they're advocating for you, and that have your best interest in mind. I know that for some of our patients, they do worry that things will come up like that here, and just demonstrating to them that, like, here in the state of California, and there are people that are advocating for you and that are wanting to ensure that you don't have to worry about those things, and that there are others that are fighting for the rights of other trans youth in those other states as well, so that they don't have to go through those things too.
Well, we appreciate you, Britt. We appreciate you giving your time and energy and efforts to this larger discussion around health policy. I think the theme through a lot of these sessions today has just been the more informed you are, the better of an advocate you can be. In our talks around mental health, media, social cultural bias today, and now trans-affirming care, that's really been the theme today. So I hope people are leaving with that energy to know that the more informed you are, the better advocate you can be. So thank you for helping us be that advocate.
Thank you all for listening. And again, I am happy to answer any sort of questions or kind of check back in with folks if they need it.